Friedreich's ataxia is a rare, inherited neurodegenerative disorder that primarily affects the central and peripheral nervous systems. It is characterized by progressive impairment of coordination and balance, as well as other neurological symptoms. In this script, we will explore the frataxin gene mutations associated with Friedreich's ataxia, the autosomal recessive inheritance pattern of the disease, the neuroanatomy, pathophysiology, clinical presentation, diagnostic criteria, disease progression, neurodegenerative changes, frataxin and iron homeostasis, management strategies, experimental therapies targeting mitochondrial dysfunction, prognosis, quality of life considerations, and emerging therapies for Friedreich's ataxia. Friedreich's ataxia is caused by mutations in the frataxin, FXN, gene. This gene provides instructions for producing a protein called frataxin, which plays a crucial role in mitochondrial iron homeostasis. The most common mutation associated with Friedreich's ataxia is an expansion of a GAA triplet repeat in the FXN gene, leading to reduced expression of frataxin protein. This reduction in frataxin levels disrupts the normal functioning of mitochondria, leading to cellular dysfunction and neurodegeneration. Friedreich's ataxia follows an autosomal recessive inheritance pattern, which means that an affected individual inherits 2 copies of the mutated frataxin gene, one from each parent. If both parents are carriers of the mutation, there is a 25% chance that each child will inherit 2 copies of the mutated gene and develop Friedreich's ataxia. Individuals who inherit only 1 copy of the mutated gene are carriers of the condition but do not typically exhibit symptoms. In Friedreich's ataxia, the cerebellum and spinal cord, which play a vital role in coordinating movement and balance, are primarily affected. The degeneration of nerve cells in specific areas such as the dorsal root ganglia and dentate nuclei of the cerebellum contributes to the characteristic symptoms of ataxia, including abnormal gait, unsteady hand movements, and dysarthria, speech difficulties. These areas are essential for fine-tuning and controlling motor function, and the impairment caused by Friedreich's ataxia significantly affects patient mobility and coordination. In Friedreich's ataxia, a neurodegenerative disorder, the underlying pathophysiology primarily involves mitochondrial dysfunction and impaired iron homeostasis. Specifically, a decrease in the expression of a protein called frataxin leads to dysfunctional mitochondria, which subsequently leads to impaired energy production and increased oxidative stress within the cells. Additionally, there is a buildup of toxic levels of iron within the mitochondria, further contributing to cellular damage. These processes collectively result in progressive loss of neurological function and neurodegeneration seen in patients with Friedreich's ataxia. Clinical presentation of Friedreich's ataxia generally occurs during childhood or adolescence and typically includes progressive gait disturbance, loss of coordination, muscle weakness, and sensory abnormalities. Additional symptoms may include cardiac abnormalities, diabetes mellitus, scoliosis, and dysarthria. Diagnostic criteria for Friedreich's ataxia include genetic testing to identify the presence of frataxin gene mutations, along with clinical evaluation and assessment of symptoms. The age of onset of Friedreich's ataxia varies but is typically between the ages of 5 and 18 years. The disease tends to progress slowly over time, with individuals experiencing a decline in motor function, worsening coordination, and increased disability. Disease progression may vary among individuals, but most individuals with Friedreich's ataxia require mobility aids and may eventually become wheelchair-bound. Neurodegeneration in Friedreich's ataxia primarily involves the degeneration of nerve cells in the cerebellum, spinal cord, and peripheral nerves. Microscopic examination reveals selective loss of large sensory neurons in the dorsal root ganglia and degeneration of Purkinje cells in the cerebellum. These neurodegenerative changes contribute to the progressive loss of coordination and balance seen in individuals with Friedreich's ataxia. Frataxin plays a crucial role in regulating iron levels within mitochondria, which are the powerhouses of our cells. However, individuals with Friedreich's ataxia have lower levels of frataxin. This leads to an abnormal buildup of iron within mitochondria. The excess iron then produces harmful molecules called reactive oxygen species, which result in oxidative stress and damage to cells. This disruption of iron homeostasis is a key contributor to the neurodegeneration observed in Friedreich's ataxia. The management of Friedreich's ataxia primarily focuses on symptom management, supportive care, and optimizing quality of life. Physical and occupational therapy can help maintain mobility and improve function. Assistive devices such as wheelchairs, braces, and adaptive aids may be prescribed. Cardiac monitoring and management of associated cardiac complications is also important. Genetic counseling can support affected individuals and their families in understanding the disease and making informed decisions. In the realm of Friedreich's ataxia research, there is a plethora of experimental therapies currently under investigation to address the underlying mitochondrial dysfunction. These novel approaches primarily seek to augment the expression of frataxin, a protein that is deficient in this disorder. Additionally, scientists are looking into the use of antioxidants to counteract the harmful effects of oxidative stress, as well as employing iron chelation strategies to mitigate iron accumulation within cells. Furthermore, some researchers are exploring methods to spur the creation of new mitochondria through an intricate process known as mitochondrial biogenesis. While these experimental therapies hold significant promise, it is imperative to conduct further research and clinical trials to comprehensively assess their safety and efficacy in treating Friedreich's ataxia. The prognosis for individuals with Friedreich's ataxia varies depending on the severity and progression of the disease. The neurodegenerative nature of Friedreich's ataxia can lead to significant disability and decreased life expectancy. However, advances in supportive care and management strategies have improved the quality of life for individuals with Friedreich's ataxia. Multidisciplinary care, including physical, occupational, and speech therapy, along with regular medical follow-up, can help optimize function and enhance quality of life. Research continues to explore emerging therapies for Friedreich's ataxia. These include gene therapy approaches to restore frataxin expression, novel pharmacological agents targeting mitochondrial dysfunction and oxidative stress, and cell-based therapies to promote neuroregeneration. While these therapies hold promise, they are still in the experimental stages and require further study before becoming available for clinical use. In conclusion, Friedreich's ataxia is a complex neurodegenerative disorder caused by mutations in the frataxin gene. Its autosomal recessive inheritance pattern, neuroanatomical involvement, pathophysiology, clinical presentation, and disease progression contribute to the challenging nature of the condition. Management strategies primarily focus on symptom management and supportive care, aiming to optimize quality of life. Exciting research in experimental therapies and emerging treatments provides hope for improved outcomes in the future.